Hi, Kendall Veruca, listing specialist with the Lucas Howard Group and board member of the ADA Business Association. Today for Spotlight on ADA, we are here with Dr. Lathe Miller at Miller Orthodontics. They're on Cascade Road between Forest Hills and Spalding Avenue, and we're going to learn all about orthodontia today. Thanks for having us.
Yeah, all about ortho in 2 minutes, right?
In 2 minutes,
yes.
yes. Everything a mom needs to know in 2 minutes.
2 minutes or less, yes.
So we were discussing earlier today, because I know my little is going to need some work done as well. What is the approximate age range for when we first find out that kids need to have some assistance in that area?
Yeah, and that's a question we get a lot, is when do I bring my kid in? And two different ways to look at it is that the American Association of Orthodontists really recommends that every child be screened around the age of 7 or 8. And then the purpose of this is not because we're going to be treating a kid at 7 or 8, but it's to screen for any potential problems that are going to get worse with time.
Sure.
And the other indicator is when your dentist decides to refer you over. And the dentists in Grand Rapids are very well educated in this, and they will tell you when you need to go as well. So, but sometimes you come in at 7 or 8 for just a little peace of mind as well.
And of course, we're both kind of the same generation. Everybody had big old clunky braces and there was nothing cool about them. Now they've got all these different color rubber banders everywhere and a lot of Invisalign. Tell us about that. Is that an option for some of your patients since they're smaller?
For our 11, 12 teenage years patients, it's become more and more of an option. So Invisalign used to be strictly an adult product, and now what we're able to use because of Invisalign's innovations is that we're able to use it on more of a teen population as well. And that comes from the comfortability of use of it, but also comes from the product being able to handle those situations. And not everybody is a candidate for Invisalign, but most people are now. So its envelope of what it could handle 5 years ago was like this. Nowadays it's like this. And so the number of people that can be treated successfully, predictably, and with a high level of quality has grown tremendously. And so then that's allowed us to kind of treat a younger and younger population.
I'm sure for the teen age group, that's a very popular option if it works for them.
Yes, it's been a highly requested way to go. So
now we always hear from everybody how wonderful your office is and how family and customer oriented and focused you are. What do you think sets you apart from everybody else? That's a main driver of our practice is to become not to treat people, but to treat the community and be a family-oriented practice where everyone feels like they've got the individual attention, and they've got access to me, where all their concerns are taken care of, and they feel comfortable in doing so. So there shouldn't be a doctor-patient type of discrepancy. We should be here working together for if it's their own treatment for their own successful outcome, or if it's for their children. And so, what I tell every patient is they've got my phone number on the answering machine. If there's any questions that come arise, that they always have access to me, and whether they can go grab me out of the back of the clinic and ask, or whether we set up a time to sit down and have a longer discussion. Because lines of communication are important, and the more that we're all on the same page, it just smooths the process. So no situations arise, miscommunications, people don't thinking one thing, I'm thinking another. We keep everything together, and I think that's what we really try and strive for, is to keep all of us on the same page and going for the benefit of the patient, and what's really been the driver of this practice. That is so awesome and amazing and so rare. You know, if you're like a lot of us moms out there, if we have a friend who's a nurse or a physician or something like that, just having somebody that you can call if you have a quick question is so comforting and reassuring. So that's just wonderful.
And we really tell our patients, if we fail in any area, you tell us and we'll correct it. And so we try and be as perfect as we can, but when things happen, we try and take care of them to the best of our ability. So.
And you said as a community or as a village, what's your favorite thing about ADA?
ADA has, since I moved to town 12 years ago, ADA has just grown, and its vibrancy has just increased dramatically. And that's what I love about it, is that we're spending the capital and the time and the people down there, is that it's become a destination again. It's become something where you want to go down to downtown Ada to see what's going on, to see what's new. you know, from the shops and the restaurants that are being put down there to beers on the bridge. I think, you know, it's got a life to it that's what I love about it right now.
Oh, and we love it too. Did you know that the last Beers on the Bridge broke a new record? We had over 3,000 people there.
It was crazy. It was fun.
Crazy fun.
Yeah, it was crazy fun. Absolutely.
Well, thank you so much for visiting with us today.
Thank you very much for having me. I really appreciate it. And if anyone has any questions or any concerns, you know, like I tell all my patients, give us a call here at Miller Orthodontics. We'll be happy to answer.
Great. Thanks.
Thank you.